dummy at nap time and bedtime is scientifically associated with a reduced risk of sudden infant death syndrome. However, there are real disadvantages when a dummy is used inappropriately or for too long. If you are a parent or carer, the dummy is often the ultimate lifesaver. It's that magical little tool that can instantly soothe a crying baby and, let's be honest, save our sanity during a rough night. But as your baby grows, managing the dummy can get confusing. When should you introduce it so it doesn't interfere with feeding? How often should you change it? And when does a helpful soothing tool cross the line into causing long-term speech delays or dental issues? If you've ever worried about how to navigate the world of pacifiers safely without sabotaging your child's milestones, you are in the exact right place. In this video, we are breaking down the honest advantages and disadvantages of dummy use and how to use and change them safely, and a stress-free timeline to introduce and stop it. To my new viewers, welcome. And to my returning viewers, thank you so much for coming back. I am Dr. Odi from Little Actions. This is your safe space for honest conversations about child health, mental well-being, and specific support for Black and ethnic minority families. If you want simple, evidence-based tips to help you navigate these everyday parenting challenges, make sure you hit that subscribe button right now and join our community. We'll start with section 1, the advantages and the disadvantages of a dummy. Let's start with the honest facts. Dummies are simply tools, like I said before, and like any other tool, they have clear pros and cons. On the advantage side, the most significant benefit during the first 6 months is that using a dummy at nap time and bedtime is scientifically associated with a reduced risk of sudden infant death syndrome, SIDS. Sucking also satisfies a baby's natural, non-nutritive sucking reflex, which lowers their heart rate and provides immense comfort for them during painful moments like colic or vaccinations. However, there are real disadvantages when a dummy is used inappropriately or for too long. First, it can act as a physical barrier to speech development. To speak clearly, a child needs to master what we call the alveolar sounds. I spoke about this on one of my videos shown on the screen right now, and I have put the link in the description below if you want to deep dive into the phonics. Second, constant sucking changes the shape of the growing jaw, which can lead to dental issues like an open bite. It can also become an emotional crutch, preventing a toddler from learning how to process big emotions or use their words to tell us how they feel. If you are finding these tips helpful and want to make sure you don't miss our upcoming guides on stress-free weaning and toddler development, take a quick second right now to hit that subscribe button and turn on the notification bell. It takes 1 second. It's completely free. It helps us get these safe, evidence-based tips out to more parents who need them. Let's start those little actions together. Let's look at exactly when to introduce and change that dummy safely. Section 2, when to start, when to change, and preventing over-reliance on dummies. Timing and maintenance are everything. So when do you introduce a dummy? If you are breastfeeding, It is best to wait until breastfeeding is firmly established, usually around 3 to 4 weeks of life. Introducing dummies too early can sometimes cause nipple confusion, which affects how well the baby latches to the breast. Now, it's also worth noting at this point that some babies simply do not like dummies. They will spit them right out, they will gag or just refuse to latch on them entirely. If this is your baby, please don't force it. Whilst it can be frustrating if you were hoping for that soothing shortcut, it's actually a hidden blessing. It means your baby is naturally wired to self-soothe in other ways. And this also means that you can completely bypass the struggle of weaning them from a dummy later on. Remember, every baby is unique, so follow their lead. Once you are using a dummy, how often should you change it? For hygiene and safety, you should replace your baby's dummies every 4 to 6 weeks. Over time, the silicone or latex degrades, weakens, and can collect invisible bacteria. Always inspect the dummy daily before giving it to your baby. Pull firmly on the teat end. If you see any splits, tears, or changes in texture, throw it away immediately as it becomes a dangerous choking hazard. Now, what if you want to make sure your baby doesn't become overly attached or obsessed with the dummy? The secret is to control its presence from day one. Do not leave dummies lying around the house or clipped to their clothes all day. If they can see it, they will want it. Use it strictly for specific triggers like falling asleep or intense distress. And once they are calm or asleep, take it away. If it falls out of their mouth during sleep, leave it out. This prevents them from forming a habit where they cannot sleep without a dummy constantly in their mouth. Now, section 3. Let's look at the golden rules for safe dummy use. To keep your little one completely safe, there are 3 absolute non-negotiable rules you must follow. Number 1, ditch the dummy clips at night. While dummy clips are fantastic for keeping pacifiers off the dirty floor while you're out and about during your day, never leave a clip, a ribbon, or a string attached to your baby when they are sleeping. They pose a very real strangulation risk in the cot. Rule 2, match the size to the age. Dummies are sized by age brackets for a reason. A toddler using a tiny newborn dummy can easily chew right through the weak silicone, while a newborn given a toddler's dummy can gag or choke. Always upgrade the size as your baby grows. Number 3, never clean the dummy with your own mouth. Yes, it's a natural reflex for a tired parent to pick up a dropped dummy and pop it into their mouth to clean it. Please avoid this. Doing this transfers cavity-causing bacteria from your mouth straight into your baby's mouth, which can cause early childhood tooth decay, sometimes called baby bottle rot, even before their adult teeth arrive. Now, section 4. When to stop and how to wean a dummy in a stress-free manner. So, what's the ideal timeline for saying goodbye to the dummy? Pediatric experts and speech therapists recommend beginning the weaning process between 6 and 12 months. By their first birthday, their physical and emotional need for a sucking reflex naturally decreases, making it a perfect window to pull back from the dummy. The absolute firm deadline is to be completely dummy-free by age 2. And this is to protect their teeth. their jaw structure, and speech clarity. Now, how do you do it without a week of non-stop crying? The secret is to stack small, manageable shifts. First, you can start by declaring the living room or the car a dummy-free zone. Next, limit the dummy strictly to the cot for nap time or bedtime only. By taking these small steps, you give their mouth the freedom it needs to practice clear speech and communication during the day, while still keeping that comfort blanket at night whilst they adjust. Remember, child development is a beautiful, complex puzzle. Managing the dummy is just one small piece of it. If your child is struggling with speech delays, even without a dummy, it's always a great little action to consult your pediatrician, a health visitor, or a speech therapist. If you found this guide helpful and want to stack more positive actions for your family health, hit that subscribe button, hit that like button, drop a comment below sharing your own dummy weaning experiences, and don't forget to subscribe for more practical parenting advice. Thank you all for watching. You are doing a fantastic job, and I'll see you in my next video.